Healthcare has been changing slowly over many years. It has become more and more expensive to access doctor visits, to have hospital admissions. In fact, the cost of healthcare is so expensive, it puts it out of reach for many Americans. And if you have Medicaid or Medicare or private insurance, you're more likely to be able to afford medical costs. But if you can only afford a low-cost insurance plan, you may not be able to afford the co-payments and the deductibles that are associated with that. And so as the cost of healthcare has been getting higher and higher, organizations are looking at ways to cut those costs and make healthcare more accessible to every American. One of those ways is through telehealth. Telehealth has become more and more common. And while it's not ideal in every situation, sometimes you need to see a doctor so that they can assess things that are impossible to see or feel remotely. In some cases, telehealth is a great answer to lower costs, lower physician costs and facility costs, and increase access to healthcare. Amazon recently acquired One Medical. This step is a big step towards a subscription-based healthcare model. And this type of a model is quite different from a private insurance model or a Medicare, Medicaid type of a model. And it could revolutionize the access to healthcare for Americans that currently do not have access to good healthcare. A subscription-based model could be viable, or it could face similar issues to the current model. One of the biggest problems with our current system is lawsuits. Lawsuits cost a lot of money. They're very common. Malpractice insurance is expensive. And so as these healthcare costs have grown, it's not so much that doctors are making more money or are taking too much money from the patient, but it's costing so much for them to be able to defend themselves against lawsuits. And so it'll be interesting to see how those type of situations are dealt with a subscription-based healthcare model. And as time plays out, we'll get a better understanding of how a subscription model can cut costs and provide better healthcare, or if it's going to be subject to the same issues that mainstream healthcare, as it's been for the past several decades, is in the United States. For many years, Medicare and Medicaid have paid lower costs to physicians than private insurers have. In fact, in 1993, the National Institute of Health reported that Medicare paid 76% of what private insurance companies paid for physician services, and that discrepancy has only grown over the years, so that as of May in 2022, the Kaiser Family Foundation reported that Medicare paid about 70% of what private insurers paid for the same physician services. And that discrepancy does not seem to be becoming more even through this year, as Medicare and Medicaid recently announced the changes to their fee schedule beginning in January 1st, 2023, where they are proposing to cut physician fees by 4.5%. So if you understand how the economy is going, it is volatile, inflation is up, physicians, healthcare workers are not going to be happy to take a pay cut. And so somehow those losses from Medicare will need to be made up. And likely physicians will take a multifaceted approach to making up for those losses. No matter what approaches they decide to take, they will most likely be increasing rates for private insurers. Physicians don't have much say with the US government. They will get paid what Medicare pays. They do have more say when it comes to private insurances. They can up the fees. Private insurance will probably pay those increases. So, how can private insurers respond to this? First of all, the proposed physician fee schedule is just a proposal. And so they should be commenting and coming up with arguments and responding to that, getting healthcare facilities involved, and they should be fighting this while they have a chance. Now, if this fee schedule does become a reality and physician fees are cut by Medicare, private health insurance may be stuck with those higher fees, so they're going to have to cut costs. And one way they could do that is perhaps changing their model for requiring referrals from primary doctors before seeing specialists. And that may also be a good change for private insurers to consider to cut costs. So private insurers should deal with fighting before this physician fee cuts become a reality. Private insurers will need to look at cutting their costs. Maybe they will need to do more digital booking, digital claims payments, try to eliminate the need for hiring another person. And they may need to look at ways to lower the number of visits that a person needs to get specialist care.